For subcutaneous injection, the vaccination site is the posterior lateral aspect of the upper arm. This area is also known as the subcutaneous tissue on top of the triceps. To identify this site, first identify the triceps muscle. The top of the muscle is visible on the back of the arm, aligned with the armpit. The bottom of the triceps muscle is normally in the middle of the patient's upper arm. Identify the injection site, which is in the middle of the triceps. Remember that every patient is different, and be sure to properly identify the site before injecting. Rub the area with an alcohol swab and allow the alcohol to dry. Verify that you have an adhesive bandage and a cotton ball or gauze pad immediately available. Check that your sharps container is placed next to your dominant hand. A subcutaneous vaccine is intended to be given into the subcutaneous tissue by injecting at a 45-degree angle. To visualize a 45-degree angle, you can first identify a 90-degree angle and then identify half of that angle. The vaccine can be administered using a 45-degree angle, injecting into the triceps from above or below. After the injection site is identified, clean the injection area with alcohol. Allow the alcohol to dry before administering the injection. Hold the back of the arm gently before you inject. Do not pinch or pull the skin too hard. Hold the syringe firmly as you prepare to inject. Inject using a smooth, darting motion at a 45-degree angle. Using a 45-degree angle allows the needle to go through the skin and into the subcutaneous tissue, which is the correct depth for a subcutaneous injection. Once the needle is inserted up to the hub, move your non-dominant hand to depress the plunger. Depress the plunger and inject the liquid. Once the plunger is fully depressed, return the non-dominant hand to gently hold the patient's arm. Withdraw the needle smoothly, activate the safety device, and put the needle and syringe directly into the sharps container. After the needle is in the sharps container, assess the injection site to determine whether blood is present. If the patient is bleeding slightly, use a cotton ball or gauze pad to apply gentle pressure until the bleeding has stopped. Then apply an adhesive bandage to the area. Visually assess the patient to confirm that they are not experiencing any signs of anaphylactic reaction or syncope. Now, remove your gloves and wash your hands or use hand sanitizer. Always wash hands and change gloves between patients. Thank the patient for coming in and ask them to wait nearby for 15 minutes or the length of time recommended based on the vaccine you are administering. If the vaccine is part of a multi-dose series, encourage the patient to schedule the next vaccine in the series before they leave the pharmacy, or make a plan for scheduling the next vaccine dose. Before moving on to the next patient, take a moment to document the vaccine given, making sure to follow all legal requirements. Thank you for watching this instructional video.